Here the surface marking has been done. This is the medial malleolus. From the posterior border of medial malleolus, draw a line towards the heel margin. Now 1 centimeter above to the heel margin, mark this site for injection. Clean skin with local antiseptic solution and apply local anesthesia. Stop. We will pass needle from the mark point to the 1/3 of the heel and will inject over there. From here, injection is not given because it causes severe pain and fat dystrophy. This mixture contains 40 milligram of dapomedrol and 2% lignocaine to the total volume of 2 ml. Clean skin with local antiseptic solution, and from the mark point pass needle, aspirate first and inject. Injection material should go freely and smoothly. Withdraw needle gently and apply bandage.